You know, before you're leaving the hospital, we need to make sure we have a good plan in place with you. You know, if you're seeking hospice care, we can certainly have a hospice consult done, or we can have the palliative care team meet with you. A lot of times the palliative care teams will talk about your goals of care. You know, sometimes we're not really sure what the goals are, and we want to be more clear and more focused on what the goals are. Your family member may not be ready for hospice at that point in time, but we can talk about what are our goals, you know, where are we going, what do we see happening, so that we can plan ahead. It's always better to be prepared, so that you're not so stressed out and your family member's not so stressed out. It's very hard when you're in the hospital sick and you're trying to make these decisions. It's better to try and have a plan in place before you actually end up in the hospital. So before you leave the hospital, we need to make sure that you have all the information you need. You understand what the warning signs are. What do you need to look for if you're getting worse? Who's going to follow up with you when you leave the hospital? Who's going to be taking care of you? Is your family member going to go home with home care? Are they going to go home on hospice? Do you need in-home caregivers to assist you? With hospice, usually there's different options in care. Your family member may go to a skilled nursing facility with hospice. They may go to a board and care on hospice. They could go on general inpatient hospice depending upon how sick they are. We do have 3 general inpatient hospice beds at Little Company of Mary that stay full pretty much most of the time. These are patients that are very sick, and these suites have been designed specifically for our GIP patients, our general inpatient hospice, so that the family can be with the patient and support the patient towards their transition, to death. So at Little Company of Mary, we give out a healthcare guide, and it's basically a guide that was produced by Medicare. And this is the website for that guide. You might want to go online and download it, but it basically tells you what kind of questions to ask, what information do you need during your stay. It's like a queuing guideline for you. The goal of any patient in the hospital is to make sure that you're well informed. You're the consumer of the healthcare, and we want to make sure that you are guided in making your decisions and that you participate in those decisions. And when your family member, you transition to home, make sure that you have appointments for follow-up. If your family member's on hospice, usually the physician with the hospice team will be out to see your family member. So the primary care doctor may be involved, may not be involved. It depends upon the primary care doctor. But usually the hospice doctor will come out to the home and see the family member in the home. With general inpatient hospice, usually the primary care doctor is still involved, and then the hospice team is involved with that patient. Make sure you understand the medications that your family member or you will be going home on. If there's a lot of pain that's occurring, make sure that the pain medications are in the home or that it'll be delivered to the home soon after the patient arrives. You don't want to go home and not have pain medication for somebody that is having pain in the hospital, because it's really going to be difficult to manage them at home once they get home. With most of the hospice companies, they have a medication vendor that will deliver the meds to the home. So you don't really need to worry about meds, but you do need to ask these questions before you're transitioned home. The most important thing is you have to remember you're the most important member of the healthcare team. So you need to participate in the decision-making process. You know, if the doctor's not explaining the information to you where you can understand it, you know, ask somebody to assist you with that communication process. And that's where palliative care comes in. A lot of the times, palliative care will come in and clarify what the plan is for you so that you understand your plan. You know, we understand you and what your goals are. You know, we look at, you know, what your background is, what you would like to see happen. Some people want everything done for their family member. Sometimes the family member didn't want everything done, so there's some confusion there. At that point in time, we may refer the case to our bioethics committee to review so that we can make sure that that patient has somebody advocating for them and for what their desires are. You know, the goal is always to be pain-free at the end of your life and to also not die alone. At Little Company Mary, we have a No One Dies Alone program. If anybody's interested in volunteering, we're actually you know, accepting people that are interested in volunteering for that program. We have people that come in and sit with people that have no family members or that are unbefriended so that that patient doesn't end up dying by themselves. It's to support the patient through that transition. Anyway, I have some additional resource sites for you. The National Transition of Care Coalition. There's a lot of information on that site about end-of-life care planning. The Health Advisory Service Group, they also have information about palliative care and end-of-life care planning. Of course, Medicare, CMS has information. And then the Care Management Department at Little Company Mary is always available to assist you. If you have a question about a family member that you're not really clear on what needs to be done next, we can work with you and with the physician and with the patient so that everybody's on the same page communicating and there's coordination of care. A lot of the managed care plans now have case managers in place. So if you're in a managed care plan or an independent physician association, they may have a case manager with your health plan that can assist you. So talk to your doctor and see if there's a case manager that can be assigned to you to assist you with your care. They're there to advocate for you and to help you make the decisions that you need for your family member or for yourself. And then also, I left my cards over here. If anybody needs any help with a family member or has any questions about different levels of care, we're always here to assist the community with information. Sometimes you may go to a hospital and you may not be clear on what you're getting as far as the information goes regarding different levels of care for family members or for planning for your family member. So, you know, give us a call, we can help you out. We do consultations over the phone or we try to help you out with whatever your needs are. So anyway, thank you.
Gloria, thank you very much for that beautiful, informative presentation, very representative of the high level of professionalism that you'll see at Little Company Mary.